So thank you, students, for joining us today. My name is Jenny Bickley, and I'm the Global Education Specialist in the Office of International Affairs at Ohio State. We are happy to have our contact from CFHI here today, Robin Young, to talk about their programs and how, as Ohio State students, you can participate. I would be happy to answer questions, so we'll maybe do our presentation, and then if you want to put questions into the Q&A, then we can answer them. It's a little easier to follow them in the Q&A than in the chat, so if we can do it that way, that would be helpful. So I know she's got a short presentation, and then I can talk a little bit about the process here at Ohio State, and then we can open it up for questions. So thanks, Robin. I'll hand it over to you.
Great, thank you so much. It's really a pleasure to be here, and it's nice to see so many of you on the session today. I'll go ahead and get started. Like Jenny said, I just have a short presentation to share with you, and then we'll make sure to leave plenty of time for questions. So are you able to see my screen? I think. Okay. So hi, everyone. Robin Young, Executive Director at CFHI. Excited to share some of our global health opportunities with you today. So a little bit about Child Family Health International, or CFHI for short. We have at this point a little bit over 27 years offering global health education programs for undergraduate and graduate health professions level students. So this is sort of our niche within international education, is working with pre-health and health students to facilitate appropriate, ethical, safe global health education programs around the world. So as you can see, we work with interdisciplinary students at all levels. We've hosted well over 12,000 students on our programs at this point, mostly from the United States, but not exclusively. We've worked with students from 40 countries at this point to facilitate their global health experiences. Right now, we offer over 20 program sites in 10 countries. These are both for virtual programs, which obviously we've all gotten really good at doing in the past year and a half. And then we are looking forward to slowly reopening our place-based portfolio starting in January. So I see most of you are thinking about May, summer. May, June, July, et cetera. So we anticipate that a large subset of our place-based portfolio will be open by then. But of course, we're proceeding with caution and remaining flexible because our top priority is your safety and the health and safety of our host communities around the world in the new context of COVID. So I was gonna just show a quick video. I'm gonna see if this works. I hope that it does. Is it still just showing a slide, or do I need to reshare my screen? It's still showing a slide. Okay.
Is your video showing on the another screen? Because you might.
Yeah, I need to like stop and then start.
Or just drag the video over to the other screen, maybe.
Oh, okay. Sorry.
There you go.
I attended CFHI's Public Health and Community Medicine program in New Delhi, India.
I recently took a trip down to Oaxaca, Mexico, where I focused on women's reproductive health.
I was one of the lucky participants to have traveled to Kampala, Uganda.
This past summer, I was able to go to Puerto Escondido in Mexico.
Across India, we have 8 programs in different subject areas. The students learn about a different healthcare system and the challenges. The students have the opportunity to learn a different language and get immersed in a different culture at the same time.
You'll not only learn from cultural experts, holistic healers, but you'll also be able to shadow and be a part of different types of medical organizations.
The work with CFHI in general is very fulfilling because I haven't had in all these years two groups that are similar. People at the hospital always learn something from you. Patients learn from you. They enjoy your company as well as the preceptors. So there is always an exchange, and that's what we call a win-win situation.
CFHI students do a lot of work. They involve in teaching VXTs. They promote our programs, like connecting us to the new technology.
These activities include constructing protected water source, water testing, adding more to the quarterly trainings that we give to the village health teams. We learn from them and they learn from us, but all in all aiming to save lives.
Me gusta ser parte del grupo de CFHI porque me permite tener contacto directo con los estudiantes. Visitan los hospitales y las clínicas de primer contacto como observadores.
Es un trabajo que me llena de satisfacciones porque me permite conocer mucha gente joven de diferentes países, de diferentes regiones del mundo, y les gusta mucho compartir con los estudiantes bolivianos, y también brindan mucho afecto, mucho carisma en la atención de los y las pacientes en sus rotaciones clínicas.
This was my actual first opportunity for me to travel out of the country. I'd never traveled out of the US before. It's fine to go out and travel and be on the beach or go on safaris, but I actually wanted to be doing something. I actually wanted to be learning something, and I wanted to be able to bring something back with me. In just 2 short weeks and being in Kampala, Uganda, it humbled me when I came back. I found that I was more resourceful, more innovative, and more creative. In my classes when I came back, I was able to I feel like I was able to bring more to the discussion.
I got to talk to Indigenous midwives, take Spanish classes, observe births, and really get to know the healthcare system in an urban and rural setting.
We got to shadow different medical care providers, physicians, nurses, also the traditional midwives, parteras, which I spent a lot of time with.
Some of the rotation sites included shadowing a doctor in a blood bank at one of New Delhi's largest hospitals, participating in a communicable diseases awareness program.
My trip taught me that health is so much more multifaceted than I originally thought as a pre-med going in. There are cultural aspects, social aspects, family traditions that all play a role, especially in regards to the perspective on childbirth and pregnancy. So not only did CFHI validate my desire to become a physician, but it also really impacted how I want to be a physician.
Through this opportunity, CFHI gave me the gift of perspective. The lessons that I learned and the stories that I was able to experience, I will not only carry with me, but they also drive and motivate me as I continue pursuing a professional career in medicine and public health.
We can do things even though we're a million miles away, and we can apply those educational experiences from the trip and make things happen.
Okay, thanks for your patience as I manage the tech, and I know that the video was a little bit spotty there at the beginning as it kind of caught up with itself. But I hope that helps to give you a little bit of perspective on the way that CFHI engages in global health and some of the opportunities available. So I'll speak in a little bit more detail about that as we go. You're able to see my slides again now, right? Okay, so our approach to global health education as a nonprofit leader in global health for students, we're always emphasizing existing health systems and resources. So on a CFHI program, you're never going to set up or participate in a parallel health system. We're always going to immerse you in an existing health system. So in an existing health-focused NGO, clinic, hospital, or some variety of all of the above. You'll be doing direct observation and shadowing under your assigned preceptors. So you'll have really rich conversations with your preceptors who are all local health experts. They're going to help you understand what you're seeing. You may have the opportunity to replicate certain non-invasive things. So after the local community health worker takes a blood pressure reading, maybe you take the next blood pressure reading, but we never put a patient at risk. And even an incorrect blood pressure reading can have really catastrophic and harmful effects on a patient. So the focus is doing no harm to you or the patient population or local community, while also really ensuring that you're having this deep, rich learning experience, expanding your understanding of the local healthcare system, deepening your understanding of determinants of health and local burden of disease. So that we put so much thought and effort into how we're setting up these programs so that they're ethical and they're safe. So another way that we do that is to focus on assets and positive efforts within communities and connect you to those, rather than overly focusing on deficits or challenges, which can sometimes have a little bit of a paternalistic or a colonial tinge to it, saying, wow, those people have nothing, let's go in and help. So we're trying to sort of flip that narrative, which is outdated and can unintentionally cause harm, and instead go in with an approach of, wow, what can I learn? We have so much to learn in the United States. Our healthcare system in many ways is not a model for other countries, and we consume a lot of resources in healthcare settings, and healthcare is unaffordable to many. So we have a lot to learn from a lot of countries, and a lot of the places that CFHI works have some version of either universal healthcare or a tiered healthcare system that is more accessible or more affordable. There, of course, also are challenges, but we have a lot that we can learn and take away from as well. So we try to frame programs with that emphasis and that learning in mind. To that end, we're always holding up local practitioners, of course, as the experts in their own environment. So we're not sending you in as volunteers to help or save or do any of those things. Of course, you have expertise and you have skills that you'll be able to share, but it's a dialogue. And as learners, we defer to the local healthcare workers that you'll be shadowing and spending time with on these programs to really help us gain that rich insight that we're seeking from these experiences. And as an organization, Child Family Health International is always striving to practice fair trade learning principles in all that we do. So this means that everyone associated with our programs is fairly compensated for their work. That includes their teaching time, their preparation time, all aspects of the program. We revisit these conversations at least annually with all of our partners around the world to make sure that there really is that mutually beneficial relationship there, that they're still interested in receiving students and enjoying it, that they find benefit in having students on their site, that they enjoy the teaching aspects. So that's just a really small piece of what fair trade learning is in the setting of global health. But, those are a few of the ways that we try to focus on that. So I mentioned too that one of the things we're sort of known for is advancing ethical best practices. There are a lot of programs and opportunities that you'll find out there that offer students unethical, unsafe, and in many ways, often even illegal ways to engage in global health experiences. So we're trying really hard to help students have access to safe, ethical, legal, appreciating local guidelines and rules, et cetera, experiences. So we've done a lot of work to document what's happening now, what we'd like to see happening, and we've published pretty widely on this subject. So if you have any questions about that, I'd be happy to follow up and share some of those pieces of literature from scholarly journals with you. I mentioned this idea of doing no harm. You know, on the left-hand image, you see a social media post. This is a student who says, suturing up the head laceration of one of the Vietnamese locals. This is, of course, not a CFHI program. Hashtag volunteer surgeon, hashtag I don't know what I'm doing. So compare that and the risk that that patient is at and the risk that that student is at in that photo with the photo on the right. So you see the woman wearing the stethoscope in the red sweater. She's actually a medical resident, and she's replicating a blood pressure reading after the local midwife who's standing right next to her already took the reading. So even though this resident is practicing in the United States, she's a pediatrician already, she's reducing the direct patient care level when she's on site in Uganda, so as to make sure that she is still learning, but also not putting anyone in harm's way, including herself. So another thing that I want to touch on in terms of, you know, sometimes you say, well, wait, I wanted to go on a global health experience because I want to practice a bunch of hands-on medicine. You know, that was my goal, was to try and really get that hands-on experience and do things that I might not be able to do in the United States. So we've talked already a little bit about why that's maybe like not the most ethical approach. But let's talk about what is there to gain. You know, if you're not doing a bunch of high volume hands-on experience on a program, but rather doing appropriately scoped and supervised clinical shadowing, or maybe some internship work at a health-focused NGO, helping them with their operations, you know, it kind of varies program to program what your day-to-day is going to look like. But what will you get out of that? You know, what are global health competencies? And the fact of the matter is that clinical skills make up a tiny little piece of global health competencies. So if you have goals in global health, you know, you think you want to be a global health practitioner in any way, shape, or form in your future, or you just want to be a more interculturally competent or culturally informed practitioner within the United States, it's important to recognize you're going to have plenty of time to work on those clinical skills. That's going to be a huge piece of your education going forward, or your technical skills. You know, if you're going to end up studying public health, you know, you'll know how to conduct a proper needs assessment. You know, you're going to get those skills. But some of those competencies in global health are much broader than those technical or clinical skills. And why is that? So this is just a simple graph talking about determinants of health and their contribution to premature death. So if we look at this, we see that 30% of contribution to premature death is genetic disposition, 15% social circumstance, 5% environmental exposure, 40% behavioral patterns. Just 10% is due to the healthcare that this patient receives or that patients receive, right? And that's before they come into the clinic, that's, you know, when they pass away. So really 90% of what contributes to a person's premature death happens outside the hospital or the clinic. And that's why having a deep understanding of those factors, what we call upstream factors of health, are so incredibly important. And that's the focus of CFHI programs. And we're helping you to develop these well-established domains of global health competency. This is from a scholarly journal. This is from the Annals of Global Health. And so they published a number of domains of global health competencies looking across many professions, from psychology to medicine to pediatrics to nursing, public health, and beyond. And they establish these domains that we really focus on for you in a global health program. So looking at developing a deeper understanding of the global burden of disease, globalization of health and healthcare, deep understanding of social and environmental determinants of health, program management, sociocultural and political awareness. Really key is collaboration, partnering, and communication. That's going to come up again and again and again in our professional lives going forward, right? So the way, you know, who's actually facilitating this learning on site? Before you travel, you'll have some orientation with CFHI. You'll probably have a live session with us. You'll also complete a number of online modules that are really going to get you prepped and ready for your global health experience. You'll have a location and program specific module, you'll have an intercultural module, and you'll have an ethics module. So you're going to go feeling really ready and having a deep understanding of sort of what to expect and how to prepare, down to like how to pack and your visas and all of those things, of course. But on site, you'll be received by at least one CFHI local coordinator. They're going to be the person who makes sure that you're picked up at the airport on time and that your host family knows what your food allergies are, right? They're going to be your go-to person if you have any questions, or if you're coming up against any challenges, or maybe the housing is not a great fit and you need some adjustment. So they're going to sort of be your key liaison. Your medical director is typically a doctor, not always. Sometimes, some of our medical directors are nurse practitioners or public health administrators. It kind of depends on the program, but they're the person overseeing all of your day-to-day health-focused activities. Normally you would have clinical rotations, or if it's a more public health focused program, a public health placement, 5 days a week, usually 4 to 6 hours a day. And then once a week, you'll have a lecture with your medical director on a salient health topic and some time to reflect and discuss cases that you've seen. Your preceptors are the individuals who are actually precepting you in the clinical setting. So you're shadowing them, you're discussing and debriefing cases, you're talking about differential diagnosis with them, if you're shadowing in the ER that day, for example. So this is your support team. These are the people who are actually going to help make this a really rich experience for you. And I touched on this just briefly, but students always say, okay, what's covered, what's included, what should I expect in this global health education program? So like I said, you have that really robust pre-departure training. It's mostly asynchronous online, but then our whole team is available. We can do calls with you. And in the era of COVID, we are planning a live orientation, virtual session that we'll do with incoming students as well, just so you know exactly what to expect in terms of COVID and how we're keeping, doing everything we can to keep you safe in that context. Airport pickup and drop off, on-site orientation, which is going to cover your safety, logistics, and cultural aspects of the program. CFHI programs include your lodging. Sometimes that's at homestay families. Sometimes it's at an apartment with a caretaker, or a guest house type setting. It varies on the program. In general, we do the most immersion possible, while also keeping the program as safe as possible. So if homestays are possible and safe, then we do that. If it's a little bit more difficult to do that, then we do more of a guest house or an apartment with a caretaker. 5 to 6 hours a day of health-focused activities, project work. If you do have some sort of project set up, especially with us, then that would be in your evenings and weekends. You have that weekly health lecture from the medical director that I mentioned, and that includes a reflection meeting. Your local coordinator usually joins for that. In Latin America, you'll have language classes in the afternoons. We'll have COVID-19 specific protocols in place, of course, and some guidelines to follow around that, just about how to best keep you safe. And then 24/7 emergency support backed by protocols that we have externally reviewed and vetted on a regular basis. And you have your team on site and then the CFHI team in the US. So in Ghana, I'm just going to give you a really brief overview to the programs that we partner with your university to offer. And then I'm happy to, answer any specific questions about any of these. So in Ghana, the areas of focus, we look at healthcare challenges. In Accra, Ghana, we focus on pediatrics. The Cape Coast program looks a little bit more at hospital medicine, but you'll see all of these themes sort of covered in the programs. In India, the main program we're focusing on right now is for Delhi. And then I do believe that later in the spring, we may have an option for the more rural urban Himalayan rotation a little bit further north. But the Delhi program focuses on public health and community medicine, integrative medicine, definitely brings in that perspective of the practice of Ayurveda. And we also have expertise and the ability to look at end of life and palliative care and some of our options there. In Latin America, the programs we work on together are in Cordoba, Argentina, where we're able to place students based on their interest, either to focus on primary care, hospital medicine, or nursing. And then in Ecuador, the areas of focus are more on reproductive health and hospital medicine as well, with a little bit of an emphasis on sort of underserved or vulnerable populations. And that is in Quito. And we do have a program in Guayaquil, which will be opening later 2022 as well. So that's kind of the overview. In terms of candidates for CFHI programs, we're looking for students who demonstrate a strong commitment to ethics and global health when they apply for the program, flexibility and adaptability and under new and changing circumstances. This slide was pre-COVID, but I think it's especially helpful now. At CFHI, we've learned to become more flexible and adaptable. We're, taking really a lot of care to make sure that we're reopening programs in a safe and responsible manner, pulling metrics and data from many different expert sources, the WHO, the CDC, the State Department, and many others, local sources as well, and having conversations with our local teams. So if we're opening a program, it means that we feel confident that as long as we all follow the guidelines that we're agreeing to for behavior and the way that we're running programs, that we've minimized risk as much as possible, and we feel really good about running the program there. So that's why we're sort of taking our time and being cautious, because again, your health and safety really is our top priority, along with that of our host community. And many of our host communities are vaccinated at a lower rate than the US. So that's something that we're cognizant of as well, and just sort of carrying that responsibility in terms of global travel. CFHI participants demonstrate an eagerness to learn and embrace new and unfamiliar ideas, and demonstrate humility, respect, and courtesy for the host community that you'll be encountering. So I'm gonna hand it over to Jenny now, who's gonna share a little bit more about the process on the OSU side.
Thanks, Robin. So I guess just to give you a little history, when Ohio State first was looking at partnering with a program like CFHI, we found that students were wanting these service learning opportunities in the medical field, and they were going out and finding their own, and potentially doing some things that they really should not have been doing in other countries. So they were not trained to do it in the United States, and they were going overseas, and they were doing the things that they really shouldn't have been doing. So we found CFHI, and we researched the options and realized that they were really giving our students the ethical opportunities that we were comfortable with and that students were comfortable with. And that's how the relationship began. So I think in 2019, we sent 13 students. And I think in 2020, we were set to send about 35 students, and then COVID hit. So hopefully we will continue to build on the program. It is from our end a non-credit bearing opportunity, but you still are able to use your STEP funds. So it is STEP eligible, so you can add those funds to support your program fee. You will start the process by submitting an application online through our office. So the program brochure has an apply now button at the bottom. So you'll submit a general application to our office. At this point, you don't need to necessarily pick your program or your country, but you'll just submit the application. Our office will review the application. The Office of Service Learning also reviews it. Make sure you look like a good candidate and an eligible candidate. And then we will respond with an acceptance and information on how to then apply directly to CFHI. So at that point, you will want to have in mind your country and your program that you're participating in. And you'll need to submit the OIA application by January 5th. In previous years, we have done a rolling admission. I know that this year, because of COVID, we are kind of proceeding a little bit more cautiously. So you can submit your application early, and we can kind of get the ball rolling. But as long as you've got it in by that January 5th deadline, you will be considered for the program. I would also ask that you guys, if you are considering applying, to begin your passport application process now. We're finding that it's taking a really long time to process passports. And with many of these CFHI programs, you also need a visa. So you're going to want to begin that process now. Submit your application for your passport so that you're ready to go when you're admitted to the program. So after the January 5th deadline, we'll consider the applications. We'll send you your notification of approval and information on how to apply for CFHI directly. As far as COVID-19 goes and global education, unfortunately, it is still a consideration that we're dealing with. We are going to make a decision by late January, early February as to whether or not certain programs are viable. So we're just asking that students hold off on making any financial commitments like buying airfare or buying a brand new set of luggage until that viability date. So we don't want students to invest any money that they may not be able to get back if Ohio State decides that travel on certain programs is not viable. So we will send you a notification at that point. And we are, optimistic, cautiously optimistic that we can get students abroad. Right now we're sending about 180 abroad for spring semester, which is about 160 more than we sent in fall semester. So all signs are pointing in the positive direction, but we are still being very cautious because, like Robin mentioned, we want students to have a global experience, but we also want it to be safe for everyone involved. So I will turn it back. I don't know if you have anything left.
Thanks. No, that's all. This is my email address. It's robin@cfhi.org. I'll also put that into the chat here, and I just welcome any questions that anyone has. Happy to chat more and answer questions.
If you have questions about the OSU side of things or the CFHI side of things, this is the chance to put them in that Q&A, and we can get them answered. So it looks like most students are planning on summer. So the way that CFHI works is that there's several different options for start dates and the length of time you can be abroad. So it's a little unique in that aspect that you can it's kind of a choose your own adventure, program where you can pick when you want to start and how long you'd like to be abroad. With Ohio State, there is also a spring semester, second half of spring semester course that you'll take. It's all online. And it's it's out of the College of Social Work to prepare you for the type of experience you're going to have. And it's not necessarily country specific. It's sort of more of a general course that you'll take. And when you're admitted to the program, we'll send you further details on how to register for that course.
And Jenny, is there a page on the OSU website that students should review the programs that you offer, or should they look directly at the CFHI site? What would you recommend?
Yeah, so I'll share my screen now and I can direct students to, I will kind of pull it up here, see if I can do it. So we can, it's just off of our webpage. And if you go to our webpage, can you see my screen navigating over here? Yeah. So you'll search programs and you can enter in CFHI and it will give you all the options that we have. So depending on which country you're interested in, you'll go to that page. That will give you information on sort of general information as well as the links to the CFHI page direct. Gives you the deadline, and then down here is the Apply Now button where you'll click that and it will take you into the application portal for OSU. So that's where you'll submit. It also has information on academics, eligibility, and financial. Most of the financial information will be housed on the CFHI website. Your program fee will be paid directly to CFHI. You will pay an application fee to our office, as well as a fee for your international travel insurance, which is about $1.60 a day. But the bulk of your payments will be made directly to CFHI. And you can find information on the program fees directly on their page.
And the important thing to remember is you definitely, your first step is to apply here through the website we're looking at right now. And then you will, once you're approved through OSU, you'll get instructions for how to apply to CFHI as a secondary step. So feel free to look at the CFHI website, look at the costs, look at the available start dates. Programs are 4 weeks or longer in duration for summer months. Someone's asking, is it possible to go for a shorter period than 4 weeks? Right now, just because we're reopening slowly due to COVID, we're not really opening shorter than 4-week programs for summer months. You know, maybe in 2023 we'll be looking at reopening that, but we're trying to keep things a little bit more streamlined right now. So 4 weeks or longer. And so check out all that info on the CFHI site, but then make sure to go back and apply through OSU first.
There's a question on how long will we be abroad for this program. So it's really up to you. The duration starts at 4 weeks and goes up. You're running 10-week programs. So whatever fits into the OSU calendar. So, you know, typically we want students to choose a duration and a start date that doesn't interfere with your academics back here. Sometimes students can make May 1st work, depending on what kind of, where the calendar falls. And then you can kind of plan it out from there. There's also a question about the Oaxaca, Mexico immersion program. At this point, we are not, Ohio State does not offer any of the CFHI programs to Mexico. That may change in the future, but right now we offer the 4: India, Ghana, Argentina, and Ecuador.
Someone asks, are the shadowing hours applicable for graduate schools such as PA or med school? So we don't, CFHI doesn't issue credit for those, but our medical directors can fill out evaluations or other things that might help to help with that question. But Jenny, I think you had something to add to that too.
Yeah, no, it's, I mean, really, you know, nothing is pre-approved here at Ohio State as far as, you know, what kind of credit for you'll get for anything. But again, you know, there's always a possibility to talk to your advisor about, you know, what the potential is there for, you know, kind of giving credit for hours on your rotations. There's a question, how flexible are start and end dates as well as duration and times? And I think we've covered that. It's very flexible. And, you know, you have the option, the May 1st, June 1st, July 1st start dates, and then you can kind of pick your duration from the selection in there too. And then obviously your program fee, you know, for each of the 4 weeks, 5 weeks is a little bit different. So just keeping that in mind.
Someone asked if there's a Spanish level test. So when you, after you get approval through Ohio State, then you would apply through CFHI. There's a simple self-assessment that you do if you're applying to a program in Latin America, where you just say like, I'm beginner 1, I'm beginner 2, and there's a few examples of what that means, and you basically state your level. But then when you arrive on site, the local language school will give you a placement test just to make sure that they're putting you in the correct level of class on site.
These are good questions. So if anybody else has any, feel free to put them out there. I get a lot of questions, students ask questions, Robin, about sort of first preference for programs and how that works for, as far as placement goes. And I mean, in my experience, most students have gotten the placement that they wanted, but I don't know how often does it happen that a student has to adjust their placement request?
It's pretty rare. you know, typically a program won't totally fill up for any given month. So it's rare. If it happens, we would contact the student directly and discuss options and offer a call to look at what their alternative options are. So definitely just apply for your first choice of program, because if for whatever reason it's not available, and I include in that, you know, maybe one of the programs, you know, we've made the decision that we can't open it for a given month due to COVID. And so we're going to offer you an alternative at a different site. So if for any of those reasons we can't offer you your first choice, we would be directly in touch with you.
Any more questions that anyone has? We will hang out here for a few more minutes until everybody is gone. So if anybody thinks of anything, and I will also put my email address. I think I've spoken to a few of you, so I'll put my email address in the chat as well. So that I think I did not share that with everybody. So that you have my contact details too. Oh, there's one more question here. Are there scholarships available to apply for? As far as our office goes, because it is a non-credit bearing program, most of the scholarships that we offer you won't be eligible for, but I know maybe Robin, you can speak to some of the CFHI scholarships that are available.
Yeah, we do have scholarships available. We have rolling application dates for those. So I'm going to put that into the chat. Just take a look and start to get a sense. We're just starting to reopen scholarship deadlines related to place-based, travel-based programs. So this will just be a page to bookmark and check back on periodically. I really encourage students to apply for these because some of the candidate pools are not huge. So you have a good chance of receiving a scholarship if you apply.
And like Ohio State scholarships, I'm sure that, writing a good personal statement and answering the questions articulately and, kind of visiting with a writing center goes a long way to helping your application along. So
definitely.
There's lots of resources on campus. So we will continue to stay here, but feel free to either, stay and ask questions, or you can, leave the session if you've got other things to do. Thank you guys for attending. I appreciate it.
Thanks, everyone. It was great answering your questions, and hope to have the chance to welcome you to CFHI program.